autistic son who is 21 years old. He has apraxia. He can imitate any simple sentences.
21
years old. His spontaneous speech is still prompted and limited to his needs in 3-word sentences. He has a cycle of behavior including self-injury and aggression. So he would be compliant and cooperative and makes progress in his programs for about 2 weeks. Then he would have about 2 weeks in which he would be very agitated, exhibits self-injury and aggressive behaviors, although he takes some medication for behavior. But on bad days of his cycle, these medications do not help to reduce the aggression. Academically, he's smart, but because of the aggression, the school district placed him in an autistic class in the county with low functioning and aggressive students. We have a good ABA program started a year and a half ago. Also, he had an ABA program when he was 7 years old for 2 years. Also, I have learned how to teach him and structured him using ABA principles since he was 3.5 years old, but nothing will help with his aggression in the bad days. We did not go into a diet route because we believe that he does not have any allergies. We wondered if you could recommend a psychiatrist specialized in autism or any other doctor who can help with his behavior. We live in Orange County, California, but we are willing to travel if you recommend any doctor located far from us. And they said, God bless you. I'm going to pass that to you so you can refer to it.
That's great. Thank you. Okay, so I think sometimes we do things and we do them for it's kind of like doing a diet. You know, you do a diet and then there's a slight thing that you're doing wrong, a tiny little thing that you're doing wrong, and you don't lose any weight at all. And then as soon as you adjust it, things start to fall into place. So I think what I'd like to do for this family is to kind of revisit the accuracy and the perfectness of everything that you're currently doing, in addition to suggesting some other things. So first thing is that with aggression and self-injurious behavior, it's not a side effect. And when you look at going to see a psychiatrist or someone who when they see something like that, especially if it's an older individual, what they will do is they will put your child on various medications that are just sort of, I call them numbing medications. They basically calm the individual down because they make you place you more or less in a sort of semi-vegetative state. Like you just don't really have the energy to do much about it, so therefore you're not going to aggress or be self-injurious. The issue, though, is still the same. It's just that we're kind of making the individual much more lethargic and, not present. So I don't really like those medications. Obviously, it's a personal choice, and if you there are any psychiatrist that you see or neurologist will actually eventually get to the point of suggesting those types of medications. So that is an option. I can't give you referrals, but I'm sure you can go to Children's Hospital in Irvine. There's a big autism center at UC Irvine. Now, from my perspective, from a behaviorist's perspective, challenging behaviors are just the individual trying to communicate something. And I don't know that we've identified what the individual is trying to communicate here. Truly, if you have a good behaviorist, then they should have already done functional analysis to determine an FBA, functional behavior assessment, to determine what the function of his behaviors are. It is likely that, I'll just throw out a big fast one to you. We call this behavior self-injurious behavior, but a lot of times self-injurious behavior or self-injury only really occurs when other people are present. And that, to me, indicates that it's quite different than the traditional definition of self-injurious behavior. Self-injurious behavior, or SIB, used to occur in individuals years ago. I'm sure there are some who still have it occurring, where it isn't attention-based. You can see the behavior occurring when they're alone. That's a quick test to tell you that this is not an attention-seeking function, but that it is probably an internal function like pain. In behavioral interventions or ABA, we refer to things as sort of intrinsic reinforcement or automatic reinforcement is what it's called. which basically means, there's an automatic function that it serves. The automatic function that it serves, I think, in most cases, is distracts the individual from the pain that they're experiencing or from some sensory need. So, like, for instance, scratching someplace that itches. Or, when you have pain, you actually do tend to put pressure on it. We all do this. If you have a headache, we tend to do this. If you have a neck ache, you tend to push down. If you have a stomach ache, you tend to put pressure on it. We put pressure on places that hurt. Sometimes self-injury is seen as, is actually a response to pain. Sometimes it's a response to the need for pressure. I mean, those are the things that I truly have seen in a lot of individuals. So self-injury is important to identify what the cause is. First of all, if it only happens in the presence of people, then that means that the person doing it, the child, is trying to tell you to get out of his face, to stop placing demands, to give him what he wants. It's an attention or a tangible function or an escape function or something that indicates he doesn't want to deal with you. So has all that been done? Have you already identified the function of his self-injurious behavior, and have you done the same for his aggression?
Right.
So identifying the function of the behavior is critical for me to be able to help you and tell you what interventions you should or shouldn't do. Now, for someone who's 21 years old and mans, he may not be, or requests things, which I think you said requests things. His requests may not be developed enough or detailed enough, I suppose, that they get his meaning across. So he might still be frustrated.
I think about the one mom who talked about, her son used a communication device, and that was great, and it was a way for him to have some functional communication. But she said, if I could wish for anything, it would be for him to have a way to be able to tell me which topping he wants on his baked potato,
right.
Because that could become a tantrum, because he was communicating saying, I want a baked potato, but he couldn't say whether he wanted chives and sour cream on it.
Yeah.
And when you think about that, you go, oh, yeah, that would be frustrating.
Yeah, absolutely. And that's why the more and more advanced you get on things like a picture exchange communication system, you basically then will get more and more detailed.
Yeah.
I mean, and that's why I also like to go to typing, keyboarding, because then you can actually type exactly what it is you want.
Yes, exactly.
But in any case, I don't want to rule out, I don't want to override any of those. I'm not sure that you have done a perfect job not you, but the behavior analysts around you have done a perfect job in terms of identifying the actual functions, because what tends to happen, and I reviewed a bunch of reports yesterday, and I saw it, and a lot of behavior analysts do this. They will, for instance, and it's a very common thing. It's nothing bad. It's just that you have to look at it from a slightly different perspective. So, I had a case where the individual had Asperger's and anorexia, and I think the behavior analysts were looking at it and saying, okay, the function of spitting out his food or not eating, he spits out his food and hides it, is an automatic function, because we can't identify why he does that. Well, he does that because he has anxiety, and therefore he's hoarding and he's avoiding food because he wants to have perfectionism. That's the anorexia side that you have to understand. So, for your child, for your son, you have to identify what the function is, and you have to go beyond the normal stuff that we think about. Like, very clearly, for instance, as I said, it could be pain.
Yeah.
So figure out what that is, because I truly do believe that challenging behaviors, 99% of challenging behaviors can be handled through behavior intervention. If it is pain, then you need to figure out what the pain is, right, and fix that. So, so many kids body rock with something in their stomach, and often it's like they just have gastrointestinal pain, and we have to fix that before they feel better. So you have to figure that out. And so, without sounding, I don't want to be bossy about this, but I do suggest that you actually get a biochemical panel on your child and determine what foods he might be allergic to. This is not a type of allergy that you see. It's not like a peanut allergy where you see someone breaking out. It's just discomfort usually, and that's why we say don't call it an allergy, the gluten and casein and so on. It's not really an allergy. It's the inability to break down these foods. Yeah. It's not like your body is reacting in the same way as an allergy. It's more that you break this product down halfway and then it turns into an effect in your brain that is like an endorphin type effect. So you need to kind of have him tested. And hey, you're in Orange County. Dan Rosignol is in Orange County. He's in, I believe, Irvine or thereabouts, and it's very easy to go to him and get all of this testing done. He's, he has MAPS. He does the MAPS training.
He's the director of MAPS.
He does the MAPS training, and therefore he can definitely help you. And that he is in Irvine, I believe, and his last name is Rosignol, Rossignal. So please contact him. He would be able to do all the testing that you need in order to see if there's anything off biochemically. And also, I mean, if he, the thing about the 2-week cycles makes me think there is something going on, because you seem to have a 2-week good cycle, 2-week bad cycle. But I would suggest, in addition to looking at the biochemical status of your child, you look at if there are different people present in the 2 weeks on and off. What changes in his environment? Does something change in his environment? And otherwise, then yes, then you're looking internally to figure out exactly what is going on. And, try not to be subjective about it. Identify exactly what you find to be different. Let's say the number of tantrums, and actually document it, write it out to the 2-week period. You might be surprised. Sometimes it just feels more, but it isn't more. I don't know. Make it very, very clear that there's a huge distinction between the 2-week periods.
Okay.
On and off. Those are some things that you might want to do.
I want, if you would be willing to elucidate a little bit. You talked last week about something, a leak, and I mentioned it the next day on the show, and we had somebody write in and say, I love this idea, because we were talking, I don't remember which question we were asking about last week, but a leak in, when you set up behavior intervention, you want to make sure that everybody is doing it, and sometimes if everybody is doing it except one person, and you were referring to that as a leak, and I love that analogy, and talked about it again on Thursday, and parents were writing in about that. So what happens if we've got a behavior intervention and everybody's doing it, but one person is messy with it or isn't doing it? What can that do to the whole program? Yeah,
I mean, it can mess up the whole program pretty badly. In fact, there's a term for it that develops in the individual. It's called behavioral contrast effect, which means that the child gets really good, or the individual gets really good in one environment and really, really bad in another environment. And by environment, I mean, could also be with one person versus another person. And you see this very often in families that are separated or divorced, where the parents are completely different from each other. You will have the child a completely different behavior in one home versus the other. And that is absolutely, and it's just simply because one person is demanding less or giving in more, and therefore the child becomes confused and essentially, or figures out, hey, I can get away with more here. This is a very typical thing, and all kids do that. So with our kids, it's extremely important because they just need to have more black and white rules in regards to what's allowed and what's not allowed. And that's a very good point, Shannon. This individual might also have different people dealing with him in a different way, and that could also produce some of this aggression. But the part of this that bothers me is the 2-week thing, because that's a very cyclic type of thing, and to me it's more of a medical issue if it is really a 2-week on and off. So you'd want to be very, very careful about that and figure out what it is exactly.
Okay, cool. Great advice. And then do us a favor and write back and let us know what progress you make and what you decide to do and what happens as a result. We love follow-ups. I want to take a second to address a question that came in on the live feature this morning. Hello, ladies, and happy holidays. My beautiful little boy is 3 years of age and has been diagnosed with autism. We will be starting the CARD journey in approximately 3 weeks. See, I already am welling up. I'm so excited for you. They go on to say, this is truly a wonderful Christmas present for the entire family. My question is, while my son is receiving 40 hours of approved ABA therapy with CARD, would it also be recommended that we add occupational and speech therapy to his schedule, or is CARD trained to help in these areas? My concern is that we have used occupational and speech therapy in the past, but due to my son having compliance issues, it was unsuccessful. Please tell me what you recommend. We want to give him everything he needs in order for him to be successful and reach his maximum potential. As always, thank you and God bless. I'm so excited for you because you show all of the hallmarks of being able to get as most done, because you're saying we're going to do everything that we can. You're starting at the age of 3 and you're excited and asking the right questions. So I congratulate you. You are doing an awesome job.
It's wonderful. And is the child 3?
3.
Right.
3 years of age.
Well, I don't think you need to worry right now because your child is pretty young. So let our team go at it for about 6 months, and if we can, let's see how his speech develops. I generally don't really need speech if things develop the way we want them to. We may add speech if we need a little bit of help with articulation later, but we don't really think we need it because we do focus on a massive amount of language and speech. So I wouldn't worry about that for now. Occupational therapy I only recommend for my kids who actually need it. So I don't know if your child needs it. That would have to do with his specific skills and deficits. So I generally will recommend OT for my kids who have some level of, let's say, sensory integration problems. So or they are, they're extremely active or stuff like that. So, it's not something that's going to be massive. Your supervisor over the next 5 or 6 months will be able to tell a little bit more whether your child needs OT. So don't worry about those things for now. If you've gotten a full program going, that's great. I hope we don't disappoint you with being able to fulfill the hours. I'm having a really big struggle right now with fulfilling hours, and we're trying very hard to increase our staff and train them, but it's hard because we take a long time to train our people, so we're doing our best. But in any case, and don't panic because your child's really young, and you don't need to start with 40 tomorrow. Like, you need to build up to 40. So, because otherwise your child will kind of freak out from that much intervention right off the bat. The one thing I would recommend is, if you want, get on my calendar or get on the calendar of our clinical director, Evelyn Kung. It'll take a while to schedule you. I don't know which office you're from. If you're in California, then please come down and see me. If you're not, I can certainly do a review over Skype with you or on the phone. But probably about 6 months to a year from now, it'd be good to see me or see Evelyn.
Okay, let me ask you in terms of this question, because sometimes, depending on where you are, if with a 3-year-old, I know in the case of Jem, the school district offered us a wide array of things when he was 3, and we declined on most of it because we wanted to do our 40-hour program with CARD.
Right.
We were advised to keep the speech and the OT so that later on, if you refuse services, it's harder to get them back. So we kind of monkeyed around and did it in a very, we put CARD hours first and gave them the opportunity of anything that was left over. I don't know that it was really beneficial for him, and it meant that I was driving around and doing a lot more driving than I needed to. We kind of looked at it as an opportunity for him to socialize with other kids while he was doing his in-home program.
OT?
Yeah, the OT and the speech, because they put him in a group of kids where they would play games, and I don't know how much benefit there was to it, but it meant it left a placeholder so that we always had speech when we continued on for IEP.
Right.
If they've got a couple of hours and they're willing to do the driving.
Yeah, I mean, it's up to you. It's not going to harm things for sure, as long as it doesn't interfere with hours we can provide.
I think that's the main
The group
thing.
aspect of it I like. It depends on where your child's level of functioning and language and on comprehension is. I don't know if they said if the school's providing it. Usually you're looking at insurance, but...
Now, is that the case? Because our school paid for speech and
You
OT.
were pre-insurance.
Yes. Back in the dark ages, like 8 years ago.
Right.
Isn't that funny?
Right.
Interesting, though. But absolutely, if your insurance is paying for it, I would rather have the
You're not going to
hours.
lose it. With insurance, if your coverage is your coverage, whether you say yes to it now or in 5 years.
Okay.
But... it is something to consider. You never want to say no to a resource that might go away just because you refused it now.
Okay, so maybe just don't sign a piece of paper from the school saying you're refusing speech and OT.
Yeah, never do that because you always want to accept whatever help anyone has to give.
Yes. Okay.
But
Awesome.
ABA is probably the most effective for your child. We'll see in 6 months to 12 months. You'll see how fast things are changing.
But
I would love to know which office you're in.
Yeah, write in and tell us which office you're in. But I can tell you that year of ABA in home, I wrote a blog about it a couple of years ago saying what a difference a year can make.
Yeah.
That before when the school was saying this is what we want you to do, and we said no, we want to go with the program and card, and they told me horror stories of what was going to happen.
Yeah.
And a year later, our child was
completely different.
So different.
Yeah.
And our circumstances were different. They were offering us the most restrictive environment at the beginning of that year.
Oh my God.
I looked at the classroom and it was kids who had helmets on that were hitting their heads against the wall.
Oh my God.
And that's where they wanted my gem to go.
That's crazy.
And a year later, he was offered full inclusion in a preschool at the age of 4.
Wow.
Full inclusion. And that year, I always tell the story that
That's unbelievable to me.
there was one person who sat there at the IEP who had worked with Lovas much later and told me horror stories and said, this is why you don't want to do this. And she and I did not see eye to eye, of course. And she wanted him to go into that classroom. And a year later, I watched as my son on that same campus was walking back. He wasn't holding hands with it. He had been with a speech teacher, and he was walking back across the campus. He was looking up at her, talking to her, and they were walking side by side.
With the speech therapist?
With the speech therapist, walking back. I was sitting on a bench watching, and I turned and I looked to the other side, and there was a little boy that they wanted Jem to be in the classroom with, walking with this person who had given me the bad advice. And every 5 feet, and it's a year later, every 5 feet she was having to stop. She was holding his hand, and he was pulling away and laying down on the ground, and she would have to pick him, and couldn't even walk down the sidewalk, which is where my son had been the year before. There was no conversation, there was no eye contact, and all kids are different.
Yeah.
But I just remember sitting there and seeing those two pictures
and just shivering and
shivering,
saying,
thinking
God,
that could have been my child.
I know, you're giving me goosebumps right now, because you think about these people who get into the field of special education, who are like old timers, I guess. I mean, I consider myself an old timer, but I came into a very kind of, I guess, radical field. When Lovas and when we started in this field, it was like nobody believed us. It was a joke. I started way before the 1987 study, so everybody was thinking like, what are these people talking about?
Yeah.
So, but my point is, they came into this field and they actually hurting people more than helping them by being closed-minded, and not believing in something else. I mean, this is a really important thing. We're not recovering and curing every child who comes into this syndrome. We all, as providers, have to be open-minded to something else that's out there. If our thing was perfect, no matter what we do, whether it's ABA or nutrition or biochemical, biomedical or dietary or whatever it is, speech or OT or whatever it is, if it was perfect, it would actually recover every single kid.
Yeah.
It's not, and it's helping a lot of kids for sure, and that's why ABA is approved and recognized, that because we are helping more kids and it's documented.
Yeah.
But the truth is, there's still people who say stuff like that, and it's saddening. It's very frightening.
Yeah, absolutely. But I congratulate you again, because you're at the right place at the right time, doing the right things, asking the right questions.
Yeah.
Exciting things are going to happen.
And please go about, and I love parents who say like they're excited about starting with us, and I appreciate you so much. Shannon is starting a an advisory and support group for parents, so please stay in touch with Shannon.
Yeah.
You can always email me. You can always email your clinical director, Evelyn Kung. You should stay in touch with us, because we love to have contact. You can always contact the QA department, the Quality Assurance Department, which is run ultimately by Evelyn Kung, but also Sienna Greener-Wooden, who directs it and runs it. And you can be in touch with all of us. We love our kids. We want to be in contact and see how your child is doing. Make sure you use our assessment center and get your child tested every year. This is all funded, but we will do this. We want to do standardized testing for your child. Make sure you contact our physician, Linda Copeland, and get to see her when she's in your office. Make sure all of your medical records are updated in our skills program, in our skills ER database. We want to have everything. The more we have and the more involved we are, the better a job we can do.
Okay.
Yeah.
I love that. We're going to shift our eyes to Wisconsin for two different questions that have come in from Wisconsin. The first one came in via email. They said, "Hi, my 16-month-old has recently been diagnosed with possible ASD, and he's going to end up at an evaluation soon for a definitive diagnosis. My pediatrician told me that we should start ABA therapy, and from there, things on the internet, there's a large difference between ABA therapies. I live in a very remote area in Wisconsin in a city called Minocqua. I'm not even sure that I've said that correct. I was wondering if we could get help finding quality ABA therapy here, and how do I know that it does right? And thank you very much." This is a question that we got endlessly at the Orange County Autism Speaks Walk over the weekend.
I'm so glad people are asking that.
Yeah, there were so many people, first of all, that I met that I didn't know about ABA still with children diagnosed with autism. But then when we started talking about it, it was the big question of the day. How do you know, how do you find an ABA provider, and how do you know that they're good quality?
That's right. And there are many different, I guess, branches developing in some ways. I consider ours its own brand card. The way we do things is different from other ABA providers, for sure. Otherwise, we wouldn't have to train BCBAs who come in for 6 months or more a year. So there's essentially, you have to, like, if we want to divide ABA, we'd say there are people who were purely trained by Lovas, and they will do they will start more of a discrete trial type program and go into what's called a natural environment training program. That would be me. That would be most of CARD, all of CARD. What we've done at CARD, which is a little different, is that we kind of added on a lot of the thinking of Skinner, B.F. Skinner, which was verbal operants, and that's a way to teach language. So we kind of included that into our program, which pure discrete trial people might not do that. It's sort of how you teach language in many different ways. And then we also are heavily into the higher level things. So we at CARD have developed a lot of programming in social skills and cognition and executive functions, and I don't think most other providers don't do that. So our program is quite different. I would say you should, if you're interested in a CARD program, we can easily offer that to you. That would be through our remote services department. So you just go online, Center for Autism, and look for remote services. You can contact our admissions office as well at CARD, and they'll transfer you to remote services. What we would do is do a full assessment anyway, and then we would send you a supervisor and hire staff in your area and then oversee your child. That's not a problem. If you want to know more about our program, you should probably get our book,
which I have the title of.
Awesome.
The title of the book is Evidence-Based Treatment for Children with Autism, the CARD Model. Practical Resources for the Mental Health Professional.
Right. And it should be on Amazon now. I know last week they sold out, so they ordered more, but it should be on now. Okay, great. So how much is it?
$60.21 on Amazon.
Is it really? It's gone up. That's interesting. So, yeah, unfortunately, it's gone up on Amazon. I guess the more people order, the higher they raise the prices. Barnes & Noble has it as well. You could probably get it through us as well, and we might give a lower price if we can buy from the publisher direct. I should try to set that up. But I would love for you to get that, because it is this is a parent who understands that ABA is different. That's a really important thing to understand. Now, then there are other people out there who will follow, let's say, the WebABLES or the VB MAP, and those are completely different. I mean, the portion of ABA programs that are going to always be the same is how we handle challenging behavior. Everybody does that the same, and that's all just techniques that everybody should know. Now, whether or not they apply it correctly is different. That has to do with the quality of training and the amount of training. If you start with an organization, you want to ask, how well trained are these people? Don't always be mistaken by the professionalism or maturity of the supervisor. That's quite different from what they know. So, we have to train them on both. We really work with our people to be mature and professional, but that has nothing to do with their content training. A lot of BCBA, we just hired a bunch of BCBAs again, And we started training with them, and we realized they have absolutely no experience in teaching. So there's two sides to ABA. One is reducing challenging behavior, and the other one is increasing deficit skills. And the portion that has to do with increasing skills that are deficient, the teaching portion, the 90% of people in the world of ABA are very limited in that thing. They're much more really very good at the behavioral portion, but not with the increasing deficit skills. So that's something you want to be able to watch and make sure the people that you're working with can do that. And I guess the overall measure of whether it's a quality program is also just the progress of your child. So if you should have behaviors pretty much under control, challenging behaviors within the first 6 months. And I would say beyond that, you should have a pretty rapid growth curve in the first year. If your child's 3, I think they said their child's 16 months. 16 months old. You have a baby, so the way that this would work is that if you get the diagnosis, you're probably going to start at 10 hours a week. And this is what I would do. I would start your child at 10 hours a week, and it would be very play-oriented intervention, focusing on the executive function skills that we can develop, like eye contact and joint attention and imitation. A lot of imitation skills have to develop, and then the beginning areas of sound production. And that's the stuff I would focus on, but it's very play-based. And then by the time your child hits 2, I would have increased to probably around 15 to 20 hours. Mm-hmm. And then after that, I would probably gradually increase between 2 and 3 to close to 40 hours, because my goal with a 16-month-old is that I could potentially finish by 4. And that is my goal. And so, you have all of that to deal with, and it's all fun, and good luck with that. Another thing I want to caution you about is that once you get into your ABA program, one of the things we do here, which is kind of important for me, is to make sure the child's also stable medically. That's sort of one of the important things, because a lot of times ABA providers don't understand that you're doing your very best. You're like doing massive hours of tutoring, and the child's not sleeping. Or the child has severe allergic reaction to stuff, or the child has severe GI problems, or the child has visual issues that we're not dealing with. You have to kind of fix the hardware, and then the software. So you have to make sure the child's eating well, getting nutrition to the brain, not reacting negatively to anything, sleeping well, feeling good, so that they can learn better.
Yeah, set them up for success in that way. Okay, cool. And then let us know if you need more assistance with that. Now, also from Wisconsin, and by the way, our viewer from Wisconsin, Mike Hipple, wrote in and said that he's familiar with where that city is. It's actually by him. And Mike wrote in a question. He said, "Hi, I'm going to be helping with daycare and adults, a day program. We're thinking about having a sensory room. We don't know where to start. So where should I start?"
Oh, that's great. Okay, so the kids have different needs, sensory needs, so you definitely want to have a series of things where there are children there are certain sensory things that are calming and other sensory things that are activating, and you need to have both of them.
And again, this is for adults.
It doesn't matter. Okay. Both the same thing. So you will have bins, like large bins that are like thin, not deep but large, that are filled with, one would be filled with sand, one would be filled with rice, one would be filled with like beans. Okay, those 3 will probably be good for some sensory interaction. Then you'll want to have an area of the room that is a calming area, so you'll want to have dimmer lights. One fantastic thing for the adults would be headphones, like noise canceling headphones, because they will really help the individuals calm down a lot. Any kind of aromatic thing, so I don't want to say candles because that's dangerous, but those things, what are those things called that have sticks and they're in liquid? Aroma things.
Yes. What are they called?
Anything that produces a positive smell will be very calming and nice. Some of our adults and children like tight spaces, so we have these suits that you can order for adults as well that are very tight. They're kind of like lycra, like elastic. They look like
it's a compression shirt.
They're compression full body suits.
Yeah.
They're they're like I don't know what you would wear when you ice skate. Like full.
They're almost like thermal, but they're not the nubby. They're like silky.
Yeah, they're stretchy. They're like gym clothing. You know, so but they're full body suits, and you can order those online. Those are. Some of our folks really love those. In fact, there's some that you can actually, they look like a cocoon, and you go inside and you pull it over your head, and it really like closes your whole body in. So that would be something you'd want to have available. Another thing that's really good is you can order one of these massive bean bags. They're like huge bean bags, and a person, when they sit in it, it kind of like covers you completely. So that's something that a lot of our adults find calming. The other calming things that you would need are like a brush for brushing the skin, a specific type of a brush. There are vibrating types of machines, like the ones that you can use, the ones that you do for back massage, for instance, that heat up and also massage. Those can be very calming. Just the feeling of it can be very calming. I'm trying to think of the other things that could be helpful. I mean, that's a lot of stuff to begin with. You want to have thick blankets and things like that, because sometimes just putting an individual in the blanket and rolling them up is like one of the most calming things you could possibly do. Let's see.
We just featured a couple of weeks ago the Snug Vest, which is the one that inflates with air, and then you can ease the pressure off. That'd be great to have one of those.
So what I need to get one of those for one of my kids.
I just thought of that. I'm supposed to remember to do that for you. But those are wonderful because it's customizable.
One of my kids, one of my kids would love to have that Snug Vest. That's fabulous stuff.
Yeah.
But more so, a lot of the things that I just mentioned are things that I've learned from my patients. They tell me, they show me that, you'll have someone who will come up to you and put your hands on their body. That's the type of person who's going to want brushing.
Yes.
You have another person who comes and just constantly wants to be held. That's someone who's going to want all those pressure types things.
Yeah.
So, or the kids who do this, or the adults who do that. They love the pressure.
Yeah.
So those are things that you can just learn from observing the person you're working with.
Sounds good. All right. I'm going to forge on ahead because we don't have a whole lot of time left. But I've got a parent who needs a little reassurance, and from time to time we all do. So she says, "Hi, ladies. My son is 4, been with CARD for 14 months. Great progress. Lately, we've been noticing that as much as he knows, he's still lacking so much. I was a big believer in this therapy, but lately I'm having doubts. We can't have a simple conversation with him. He's still not interested in any of us. The last month, he seems to be enjoying negativity too much, for example. He hits his brother while his brother is crying. He laughs. If I tell him that it's not okay to hit, he laughs. He seems to be enjoying destruction. Should I be concerned that I will have a weird son that will enjoy hurting others, or will it get better? The tantruming is over. Everything, including a simple the tantruming is over everything, including a simple how was your day. He repeats our phrases like don't touch that. He touches it. Don't paint on your hands. He does it. So I'm confused. I thought he was supposed to get better. I don't see how that's possible. He speaks, reads, on a great diet, sleeps great. Please, I want to cry. Reassure me, please," she wrote.
No, I do want to reassure you. You don't need to worry. With all the things that he's doing, he's going to do very well. You've been in the program for 14 months. He's only 4, so you have nothing to worry about. You're ahead of the game. But on it's easier for me to see that because I can see the 3-4 year period of time. For you, you're living it every day, and if he tantrums, that's not okay. So here's what you need to do. You need to get on my calendar. It will serve 2 functions. One is either mine or Evelyn Kong's, or ask for a consult with one of the seniors. That's all you do. Don't worry about offending anyone. I don't know who your supervisor is, and I don't know what office you're from, but everyone consults with us, so don't worry about that. There's a little bit of a difference if you've had 35 years of experience versus 5 years of experience. So no one is offended if you want to see me or Evelyn, who's been with me for 20 years, or Sienna, or any of the seniors. There's a lot of seniors at CARD who've been here post 20 years. So please request a senior consult. The thing about all of these behaviors is two things happen when we see you. We go through and troubleshoot and see like all the things and make sure everything's perfect. Sometimes I'll do a clinic and I'll be like, it's fabulous, it's great, nothing. And that really reassures the parent. Sometimes I'll change things because I have a perspective from a different set of eyes and I'm not right in the middle of it, and I can look at it and say, no, move this around and so on. Sometimes all that it serves is your supervisor wakes up, and says, I gotta make sure everything's perfect and keep it perfect. And every human being needs a check once in a while. We check our people. There's every supervisor has a local boss, and then QA is their boss, quality assurance. But let me please get involved, or let Evelyn or one of the seniors. My calendar is pretty bad, so it might take a while for you to get to see me. Please just get on it, no problem, even if it's 6 months or a year from now. But wherever you are, I have a senior somewhere, and they can see you. So if you're interested in that, write back to Shannon, and we'll connect you with the right person.
Okay, and just
don't worry.
Yeah, the other thing that I want to throw in, because I love, it's a resource that we're going to play in just a few minutes, the A word.
Yes.
There is an episode that I don't know which episode it is, but it's exactly a moment in time like what you're experiencing, where Jack Riley's made a bunch of progress and they're all excited, and then all of a sudden Jack Riley starts to bite his mother. He won't walk down the sidewalk with her. He's biting. He threw a tantrum at an event, and there's a moment where the dad is saying, I don't know anymore. I thought we were just going to make steady progress and we were never going to go backwards, and now this is happening and I don't know what to do. And he has a moment where he's saying, I feel like I'm losing faith, like this great wonderful thing that we had, weren't we supposed to make steady progress? And their therapist comes in and says, here's what we're going to do about this behavior, and they go through showing how they implement it so that Jack Riley stops biting. But it's wonderful. I, as a parent, love watching that, because I can remember when anything would happen, I would go, oh no, the sky is falling. That's exactly what it felt like to me. And I would panic because we lost skills. So anytime something happened where it felt like regression to me, it was, what they say about it, if it's hysterical, it's historical. And I would get hysterical because for me, it was historical. Yeah. So I want you to watch that, to know that you're not alone, that this is sort of a typical thing that happens with our kids, that they will cycle in and out of some behavior, and that it's infinitely fixable, and our kids do it. And also the idea of, he's learned so much, but he's got so much more to learn. Right. I remember feeling like we were standing at the base of Kilimanjaro when I found out all the things that my son was behind on, and I was looking up at the top of the mountain going, we're never going to get there. Even when we'd made progress, I was looking up going, we're never going to get there. And the thing that my team kept reminding me is, know what the top is, know where the top is, but keep your eyes on the road that you're on. Yeah. Be in this moment, because, the only way anybody gets to the top of Kilimanjaro is by taking step by step by step, and then eventually you find, wow, I'm significantly higher up the mountain. You got to know where you're going, but then focus on the road in front of you.
Yeah, and don't and realize that a lot of times, I go through this with my own kids, realize that a lot of times it's our own fears. It's not really, the child might have a slight dip, but every child does. Yeah. And that dip seems to us as, a monumentous failure because... Is that a word, monumentous?
Monumental, maybe.
Monumental.
I like monumentous,
Thank you. That's my British and French and every word mixing it. But it's like, it feels like a huge fall and failure, and it's not. That's our own fears of. It's our own fear of, oh my God, we're regressing. Yeah. So once your child's acquired stuff, they're acquired. They have already acquired. every child has phases where they will test.
Yep.
Now, and you need to realize that it's now your opportunity after 14 months to use your skills. You've learned a lot. When your child does stuff, you should know what to do now. If you don't, then ask your supervisor to work more with you and figure this out together. So, get back with us. Let one of my seniors get involved and help.
Yeah, absolutely. There is help for you, and I firmly believe that things are going to get better. I also think that when our kids cycle into a new behavior, it's a sign that they're growing.
Right.
And that's a good thing. It doesn't feel good to us as parents, but you'll get there. And keep reaching out and get on Dr. Granpeesheh's schedule.
Or any of the seniors.
Absolutely.